I had had headaches, migraines, for 7 months straight and had been through every other medical kind of treatment to try to resolve the migraines. And a friend of mine finally said, hey, why don't you go see my dentist and see if he can help you? By the time I got to Dr. Smith here, it had gotten to the point where my migraines were either a 1, 2, or a 3. And 1, I'm awake and my head really, really hurts, but I'm gonna go to work. And a 3 being, yeah, I'm just gonna go back to bed. So I was spending more days at a 3 level than anything. There was no need to describe headaches on a scale of 1 to 10 anymore. What Dr. Smith discovered is that I'd never had braces as a kid, and so my teeth didn't fit together right. And what looked like an underbite was really my body compensating for my teeth being out of alignment. And that muscle strain is what was causing the headaches. I was doubtful that this was gonna work because we'd been through so many other things. I had tried, anti-seizure medication and hospitalization and IV drips and all kinds of craziness. Acupuncture, you name it, we probably tried it. We went through the mapping process, and there's a big head unit that he puts on and maps the movement of your jaw opening and closing, and went through all of that. And what we discovered is that my underbite wasn't a normal, I guess, what he typically sees. And so he was even kind of surprised. But Dr. Smith came back and said, hey, we can fix this really easy. I wore an orthotic on my bottom teeth for about a year and braces on my top teeth to start to move the top teeth into the right position. The immediate results, just a few weeks in with the orthotic and the braces, feeling the relief. I had forgotten how it felt to not have headaches. So that was really encouraging and made me want to stick with it, even though braces at 38 wasn't exactly what I had in mind. He actually had to do some special research, kind of put me on hold, put me in a retainer, and he went to a conference in Las Vegas, came back from that conference, and June called me and said, hey, we've got an idea, but we need to do some more research, and just want to let you know, hang in there, Dr. Smith's working on it. And I got a call about 6 weeks later and said, okay, come back in. We think we know what we want to do. And he had done research and gone to actually receive training to learn about a DNA appliance that is what I'm using now, which helps to finish the expansion on my upper palate and finish the work that we started. So the goal being to get my teeth all in the right alignment so they don't revert back and I don't end up with headaches again. It was awesome to know that he was that dedicated to finding an answer for me, and we'd exhausted everything that he knew that he had already done, and that he was dedicated to finishing the work for a long-term resolution. I have complete faith in his ability, in his dedication to us as patients, and his ability to really look beyond standard approach, beyond standard treatment, and to get creative and to continue to search for options that work. So once he relieved the muscle strain and started to position my teeth in the right place, the headaches were gone. The staff here is awesome. I feel like I'm meeting friends for coffee or drinks after work. It's the way that I'm greeted when I come into the office. Jada and I will sit and chat, I think, long after my appointments at times. It's the next patient that comes out that I'm like, oh, I should leave. I'm in the way. But everybody here is so friendly. June has been a huge help trying to figure out treatment and getting insurance approvals and looking at different, financing options for some non-traditional courses of treatment, and just everybody here. They're always friendly. I know them. We talk about each other's kids. We share recipes and workout tips, and it's a lot of fun. I'll continue to come back here because of the way they've treated me, because of the success I've had, because they're friendly. You know, I trust them.